Human metapneumovirus, or HMPV, is a common respiratory virus. It infects people of all ages. HMPV was first discovered in 2001. Despite its relatively recent identification, it is now recognized as a major cause of respiratory illness worldwide. The virus spreads through respiratory droplets. These are released when an infected person coughs or sneezes. HMPV is highly contagious. Infections are particularly common in young children. Most children will have had an HMPV infection by the age of 5. While many experience mild cold-like symptoms, HMPV can lead to more serious illnesses. These include bronchiolitis and pneumonia. The elderly and individuals with weakened immune systems are also at increased risk of severe HMPV infection. Understanding the characteristics of HMPV is crucial for public health intervention. HMPV is an RNA virus. This means its genetic material is RNA, not DNA. This distinction is important for developing antiviral treatments. RNA viruses like HMPV are known for their ability to mutate rapidly. This poses a challenge for vaccine development. The global prevalence of HMPV underscores its significance as a public health concern. HMPV infections occur year-round. However, they tend to peak in the winter and spring months. This pattern is similar to other common respiratory viruses, such as influenza and RSV. The widespread nature of HMPV and its potential for severe complications make it a key target for public health surveillance and control measures. HMPV infections typically manifest as mild respiratory illnesses. Common symptoms mirror those of the common cold. These include runny nose, cough, sore throat, and fever. In many cases, especially in healthy adults, HMPV infections resolve on their own within a week or two. However, HMPV can lead to serious complications. Infants, young children, the elderly, and individuals with weakened immune systems are most vulnerable. In these groups, HMPV can cause bronchiolitis. Bronchiolitis is an inflammation of the small airways in the lungs. This can lead to difficulty breathing, wheezing, and coughing. HMPV can also cause pneumonia. Pneumonia is an infection of the lungs that can be life-threatening, especially in vulnerable populations. The severity of HMPV infection can vary greatly depending on the individual's health status. Underlying medical conditions such as asthma, heart disease, and chronic lung disease can increase the risk of severe HMPV illness. Premature infants are also at increased risk of serious complications. This is due to their underdeveloped immune systems and lungs. Recognizing the symptoms of HMPV and understanding the risk factors for severe illness is essential. Prompt medical attention is crucial for individuals experiencing difficulty breathing, high fever, or other concerning symptoms. Early diagnosis and appropriate medical care can help prevent serious complications and improve outcomes for those infected with HMPV. The widespread prevalence of HMPV and its potential for causing serious illness create a significant public health challenge. The virus places a burden on healthcare systems worldwide. HMPV infections contribute to hospitalizations, particularly among young children and the elderly. This strain on healthcare resources highlights the need for effective prevention and control measures. The economic impact of HMPV is also considerable. Parents and caregivers often need to take time off work to care for sick children. This results in lost productivity and wages. Additionally, the costs associated with medical visits, hospitalizations, and medications contribute to the overall economic burden of HMPV. Addressing the public health challenge of HMPV requires a multifaceted approach. Public health education is crucial. Raising awareness about HMPV, its transmission, and prevention strategies is essential. This includes promoting good hygiene practices. Vaccination, while not yet available for HMPV, is an important area of research. Developing effective vaccines could significantly reduce the burden of HMPV infection. Effective surveillance systems are also vital. Tracking the spread of HMPV, identifying outbreaks, and monitoring the emergence of new strains are essential for implementing timely and targeted public health interventions. International collaboration is key. Sharing information and coordinating efforts across borders are crucial for controlling the spread of HMPV and other infectious diseases. Currently, there is no specific treatment for HMPV. Management of the infection primarily focuses on relieving symptoms. Rest, fluids, and over-the-counter medications can help alleviate fever and discomfort. In severe cases, hospitalization may be necessary to provide respiratory support. Preventing HMPV infection relies on measures similar to those for other respiratory viruses. Good hygiene practices are paramount. Frequent hand washing with soap and water is crucial. Hand sanitizers containing at least 60% alcohol can be used as an alternative. Covering coughs and sneezes with a tissue or elbow helps prevent the spread of respiratory droplets. Research into HMPV is ongoing. Scientists are working to develop effective vaccines and antiviral treatments. Understanding the virus's genetic makeup, its modes of transmission, and its ability to evade the immune system are crucial for developing targeted interventions. The China CDC plays a vital role in these efforts. The China CDC is a leading institution in infectious disease research, surveillance, and control. Their work on HMPV includes monitoring the virus's circulation patterns, identifying new strains, and evaluating the effectiveness of prevention and control measures. The China CDC's expertise and resources are essential for advancing our understanding of HMPV and developing strategies to combat this global health threat.